Hello, and welcome to Tank 48's Donor Anatomic Record Project. Tank 48 included Zachary Adams, Andrew Beerb, Amy Rivette, and Lauren Tran. Our cadaver was a Caucasian female. She was 82 years old at the time of death. Her last known occupation was housewife, and her cause of death was severe metabolic acidosis. Upon comparing our cadaver's two kidneys, it was immediately obvious that her right kidney was significantly smaller than her left. This condition is known as right renal hypoplasia. What this amounts to is a kidney with still functioning nephrons, but with reduced filtration capabilities due to the drastic reduction in size. We felt that this anatomic variation likely played the largest role in her cause of death as metabolic acidosis. Healthy kidneys will play a large role in acid-base balance in the body. If the body becomes acidotic, the kidneys can excrete excess acid that's building up in order to help increase the pH of the body. Our cadaver's reduced kidney function due to the right renal hypoplasia likely impaired her ability to excrete all the excess acid that was building up. We also noted a few cysts on both of her kidneys, but found that they were probably benign as they were very few in number. An interesting anatomical variation that we found in our cadaver was a retroesophageal right subclavian artery. This occurs during development due to the involution of the right fourth pharyngeal arch artery and right dorsal aorta cranial to the seventh intersegmental artery. The right subclavian artery typically branches off of the brachiocephalic artery. However, in our cadaver, her right subclavian artery came directly off of her aorta. From our research, we found that this is typically a benign condition and usually will remain asymptomatic. Also, most people may never know that they have this anatomic variation, so it can often go undetected. When we opened up our cadaver's abdomen, we noticed an extremely large and distended colon. As we looked a little closer, we noticed that her rectum and part of her sigmoid colon were attached to the abdomen wall somewhat. This probably indicated a rectal cancer that had invaded the nearby wall. We believe that this caused narrowing of the anus and prevented adequate bowel movements. With bowel movements not being able to be easily passed, they probably backed up in her colon and caused the colon to become far larger than it was ever originally. This finding also could have played a role in our cadaver's metabolic acidosis due to the fact that tumor cells have high metabolic activity, which can result in hypoxia and cause acidotic conditions. Our cadaver's lungs also showed signs of emphysema, which is a chronic obstructive pulmonary disease. Emphysema results from the destruction of the alveolar walls. This causes a reduction in airflow due to the lack of alveolar elastic recoil necessary to get air in and out of the lungs. Although the emphysema was not a direct cause of our cadaver's metabolic acidosis, it very well could have played a different role in her disease. If the body becomes acidotic, the lungs can help the body compensate by performing what's called respiratory alkalosis. This basically is hyperventilation, which reduces the amount of carbon dioxide in the lungs, which can help raise the person's pH, thus combating a low pH that would be found with acidosis. The emphysema may have hindered her body from employing this compensatory mechanism to help reduce the acidotic condition in her body. When we examined our cadaver's intestines, we noted some scar tissue banding around the cecum and small intestines in the area. This scar tissue was essentially acting as a rubber band, tying off the part of the cecum and small intestine that it was attached to. This significantly reduced the lumen size at each point of attachment and would have significantly decreased her ability to pass waste product from her small intestine through her cecum and to her ascending colon. There are two possibilities as to what could have caused these strange scar tissue strictures. She was missing her appendix, which indicates that she had a previous appendectomy. Dr. Campo explained to us that any kind of abdominal surgery can result in scar tissue formation such as this, and that these scar tissue formations are often unavoidable. Due to the fact that the appendix is adjacent to the cecum, we found that her previous appendectomy was the most likely cause of these scar tissue bands. Our cadaver also had a hysterectomy, which could have caused these scar tissue strictures. These findings likely played no role in her metabolic acidosis, but would have likely caused other symptoms such as abdominal pain or discomfort at the very least. In summary, we believe that a confluence of factors contributed to her decline and ultimately her cause of death. The most significant of these being her atrophied right kidney, due to the fact that kidneys play such an important role in acid excretion. This would have severely impaired her body's ability to get rid of the excess acid that was building up. This also would have caused a decrease in production of bicarbonate because of the kidney's ability to produce bicarbonate. The advanced state of her rectal cancer could have also significantly contributed to her acidotic conditions due to the lactic acidosis and prolonged tissue anoxia that occurs in tumor cells. The pyelonephritis that we noted in her left kidney would have also reduced the acid excretion and would have caused a decreased production of bicarbonate. Finally, her emphysema would have reduced her body's ability to perform compensatory respiratory alkalosis to combat the metabolic acidosis. The pathologist's cause of death was listed as severe metabolic acidosis. During our dissections, we found right renal atrophy, chronic pyelonephritis, and rectal cancer, which can all cause metabolic acidosis. As noted before, these were likely further exacerbated by her emphysema and lack of compensatory mechanisms for the acidosis. Therefore, we agree with the pathologist regarding her cause of death, as it seems to be difficult to pinpoint just one cause due to the fact that she exhibited multiple diseases that could have contributed to this condition. And these are our references. Thank you very much for listening, and we hope that you enjoyed our presentation.